Hi there, my name is Kyle Morrison. I'm a student with the F&P program at Valdosta State University. This is my wife, Carly. Do you give consent to be on the video?
I give consent.
Okay, so we're going to begin with a HEENT session. We're going to go through starting with the head and then all the way to the neck. So let's begin. Okay, so first we're going to view the head. We can see here that it's normocephalic and atraumatic, no signs of any kind of trauma or scabs, anything of that nature, no moles. Now that we have assessed the head, we're going to assess the face in general. So for the face, if you would, raise your eyebrows, lower your eyebrows. No, you did it. Good job. Go ahead and smile, frown, good. Puff out your cheeks, good. So that takes care of cranial nerve 5. And then we're going to assess her sinuses and her TMJ. So first we're going to lightly tap the frontal sinus here, the ethmoid sinuses, the sphenoid sinuses, and the maxillary sinuses. Now, did you happen to have any tenderness?
No.
Okay. So, no issues with the sinuses there. Now we're going to test the TMJ, the muscles of mastication. So, go ahead and open your jaw. Close. Good. So, we're looking for any signs of popping or crackling, which would be indicative of temporomandibular joint dysfunction, which that wasn't present. And so now we're going to assess cranial nerve 7 with pain and soft touch. So, just to demonstrate first, this is sharp. Feel that. That's soft. Can you feel the difference? Okay. So go ahead and close your eyes. So we're going to first test the occipital. Sharp. Soft. Okay. Maxillary.
Sharp.
Okay.
Soft.
Good.
Sharp.
Good.
Soft.
Okay. Mandibular.
Sharp. Soft.
Good. So cranial nerve 7's intact. That takes care of that. Now we're going to move on to the nose. We're going to take this light source here. We're going to ask the patient to look up a little. Gonna push the nose up. Now I'm looking and the septum appears midline. No signs of perforation or trauma. Mucous membranes are pink and moist. There is a moderate amount of nasal discharge, kind of a clear, yellow, watery substance. So I assume you've had a cold within the past few days. Okay. Now we're also going to assess smell. So if you would, close your eyes and tell me what this smells like.
Orange.
Good. It was tropical twist, but good. Okay, so now that we've assessed the nose, we're going to move on to the ears. Now for the ears, we're going to take the same light source here. Okay, the otoscope. And we're going to first assess if there's any tenderness over the pinna, the tragus here, the auricle. And we're also going to check behind the ear just to make sure there isn't any kind of growth which can occur. Let me check your other ear. Okay, same thing. Any tenderness?
No.
Okay, so we're not looking at any kind of otitis externa or media. Now we'll go ahead and check both ears. So I'm going to grab the pinna here, pull up and back. Let's see. Ear canal does not appear erythematic. Tympanic membrane. Sorry, I gotta press in there. Tympanic membrane is a pearly gray. Cone of light in relation to the umbo is at the 5 o'clock position. There we go. Okay. And tympanic membrane was also in a neutral position. There was no signs of swelling or exudate, which would be indicative of otitis media or externa. Externa being the arrhythmia that you'd see within the ear canal. So let me check the other side. Cone of light is in the 7 o'clock position in relation to the umbo. Ear canal does not appear arrhythmatic. Tympanic membrane is in a neutral position without signs of inflammation. So now that we have done the ears, we are going to assess the mouth. So for the the ears.
Eyes.
Yes, the eyes. Thank you. My patient is on top of it. So I'm going to assess the eyes. So first, got to get my ophthalmoscope. Okay, so here we have a Rosenbaum chart. The Rosenbaum chart was chosen because the Snellen chart, you have to do a visual acuity test of 6 feet with that chart, but for the purpose of this video, we're going to use the Rosenbaum. So the Rosenbaum, we're going to hold the card approximately 36 inches from the patient, and we're going to ask the patient to start with the top line and go down. And we're going to start off with both eyes, then cover one eye and cover the other eye. So if you would, try and read starting from the top line. This, it's at the right spot.
Okay.
All right, so start at the top.
95.
Keep going.
874. 2843. 638. 8745. 63925.
Wait, yep, go on.
428365. 374258.
Okay.
937826. 426739.
Very good. So, with both eyes, OU, the patient exhibits 20/20 vision. Unfortunately, I didn't have a 2015 vision test, but she is 20/20. So now let's cover the right eye, or OD. So we're testing OS.
95874 2843 638 8745 63925
Okay.
428365 374258 937826 426739.
Okay, very good. So OS is 20/20 vision as well. Now we're going to cover the other eye. Okay, good. So once again,
95874 2843 638 8745 63925 428365. Maybe.
Yeah.
37425 I can't read the next one.
Okay. So for the right eye, or OD, she has a vision of 20/30. Okay, so that takes care of the visual acuity test. Now we're going to test peripheral vision. So if you would, look straight at my nose. Okay, tell me when you can no longer see my fingers.
I can no longer see your finger.
Okay, so peripheral vision's intact. Now we're going to do the cardinal fields of gaze. If you would, without moving your head, watch my fingers, okay, with your eyes only. Is that okay for it to? Okay. Good. Accommodation noted. Good. So the 6 cardinal fields of gaze is intact. With accommodation. Now we're going to look at the eyes in general with our ophthalmoscope. So just keep looking at my nose for me. Just looking, I'm noting that the sclera is white, non-icteric, non-injected. The conjunctiva is clear. Keep looking at my nose. Pupils are round, reactive to light, with consensual light response. So now I'm going to take a look inside of your eyes, specifically cranial nerve 2. Okay, so if you would just keep looking directly ahead. Okay. Very good. Optic disc is well marginated. No signs of swelling, no signs of AV nicking or neovascularization. Same thing over here. Keep looking directly ahead. Following into the disc. Okay. No signs of AV nicking. Again, the disc is well marginated. Okay, very good. So that takes care of the eyes. Okay, now we're going to assess the mouth. Okay, so just getting my light source here. Go ahead and open wide. Very good. Okay, so mucous membranes are moist and pink. Move your tongue up and down, side to side. Good. Say ah. Okay, uvula is midline. It rises. Tonsils are hidden within the pillars, so +1. Go ahead, yep. Okay, and then let's go ahead and test gag reflex and taste. I know. Alright, so.
Is it flavored?
It is flavored. That's how we're going to test taste. Alright, so first we're going to test gag, and then right after you gag, you can tell me what flavor it is, probably. It's okay. I'll be gentle. Here. There. Okay, gag reflex is intact. What flavor was that?
Grape.
Very good. Alright, was great. Okay. So that takes care of the mouth. Now, I also need to do the hearing test before we move on to the neck. Okay, so what I'm going to do first is the whisper test. I'm going to whisper a 2-syllable word, one within one ear, one with the other, and see if the patient can recall them. Okay? Let's see. So occlude your other ear for me. Thank you. What was that?
Puppy.
Very good. Now let's do the other ear.
Flower.
Very good. It was indeed puppy and flower. Now we're going to do the Weber test, or some people pronounce it Weber. That's a test where I strike the tuning fork and I place it on top of the patient's head, and the sound should not lateralize to either position or either ear. It should lateralize to both the same. So let's go ahead and test that. Tell me if it's the same in both ears.
It's the same in both ears.
Well, you don't have to tell me, but is it?
Yes, it is.
Okay, very good. So now the next test is the Rene test. The Rene test, I'm going to strike the tuning fork and place it on the mastoid here, and you're going to hear it. When you can no longer hear it, I need you to tell me, and then I'm going to place the tuning fork right by your ear, and I need you to tell me when you can no longer hear it again.
Okay.
Okay, so let's get the hair out of the way. All right. Okay. So let's do the other ear. Bone conduction should be half of air conduction, which that was the case. Now let's test the other ear. Good. All right. So that takes care of the face, head, ears, eyes, nose. Now we're going to assess the neck and speaking of the throat, when I was inspecting the mouth, one thing to look for is any drainage in the posterior pharynx, which in her case there was none. Nor was there a cobblestoning appearance, which would be indicative of something along the lines of allergic rhinitis. Now, for the neck, we are going to do a posterior approach to a thyroid palpation. Now, it's good to notice that her trachea seems symmetrical in midline. Okay, and go ahead and swallow. Good. So thyroid is not palpable, and swallowing's intact. So now we know cranial nerve 10 and 12 is intact. Now I'm going to feel for her carotids. Good. Good. So it's +2 equal bilaterally. Palpated the thyroid, palpated the carotids. We're going to listen to the carotids for bruits using the bell of our stethoscope. No bruits are noted. Okay. Let's see. And I believe that concludes our HEENT. Oh, with one exception. We need to test cranial nerve 11. So to test cranial nerve 11, I'm going to have the patient move, look to the right against resistance. Good. Now left. Good. Do ear to shoulder. Good. Ear to shoulder. Good. Now shrug your shoulders. And then shrug them again. Good. So that's +5 resistance, or +5 strength to resistance, and cranial nerve 11 is intact. Now that concludes an HEENT assessment. Thank you. Bye.